If you're not a daily flosser, this might convince you to step it up. There's more evidence that poor oral health may have a significant impact on cardiovascular health. In tonight's Health Watch, new research links gum disease and cavities to a higher risk of stroke. We know it's important to take care of our teeth and gums and to see a dentist for regular checkups and cleanings. Now, two new studies published in Neurology Open Access add to growing evidence that keeping your mouth healthy may help keep your brain healthy, too. The first study found adults with gum disease may be more likely to have signs of damage to the brain's white matter than people without gum disease.
Gum disease is associated with a higher chance of inflammation, and inflammation has been tied to atherosclerosis as well as hardening of the small blood vessels, as we saw in this study.
Dr. Savek Sen with the University of South Carolina School of Medicine led both studies. The second study found having both gum disease and cavities is linked to an 86% increased risk for stroke compared to people with healthy mouths.
What the study suggested was that if you have cavities on top of gum disease, it is double trouble, means your risk of stroke or adverse heart event doubles.
But there's some good news.
Somebody took care of their mouth, including brushing, flossing, as well as visiting the dentist regularly for their preventative cleaning. Their risk of having a stroke dropped by as much as 81%, which is a very big finding.
With 3.5 billion people worldwide suffering with gum disease or cavities, researchers say prevention and treatment could be an important part of stroke prevention. Now, the study's author adds that this research just shows an association and doesn't prove that poor oral health causes strokes. The American Heart Association reports nearly 800,000 people have a stroke every year here in the U.S. For a closer look, go to the features section of our website, 2news.com, and click on the Health Watch icon.